So how you doing? No, I'm the host who really wants an answer. I'll wait, particularly considering the fact that how you're doing may have an answer based on how you did last night. Did you get a good night's sleep? Well, we're going to try to help you get a good night's sleep next time. Boy, this is a subject that absolutely everybody can relate to. No matter what else we talk about any day, this is the one that is shared with everyone, right?
Right. It's something that we all do 2/3 of our life, and so it's very important.
Well, of course, there's a whole bunch of cynics out there who are saying, oh, yeah, who's that lady who says so? Lori, introduce yourself by name and title.
I'm Lori Ledley, and I'm the founder and president of Valley Sleep Centers here in the Phoenix metropolitan area.
And how did you get to be a sleep expert?
I actually started out as a respiratory therapist, and then I started testing patients at home and then became very interested in the overnight sleep aspect. And so started to think there's got to be a better way. Went back to learn sleep at Banner Good Samaritan. I became a sleep technologist, and I wanted patients to be able to have a less clinical environment. So I had a vision, and I developed sleep centers that have private suites and their own bathrooms, and just it's a really more of a home-like environment. And now we're even testing patients at home.
How's the respiration and your original specialty associated with sleep, or the lack thereof?
Well, being a respiratory therapist, we specialize in helping patients breathe. And at night, your breathing is very important. If it gets occluded or you stop breathing, you can have something what we call sleep disordered breathing. And sleep disordered breathing can be detrimental to your overall health. It can cause cardiovascular disease. Now they've linked it to diabetes. There's even a study just in the past month that's come out that you have a higher risk of dying of cancer if you have sleep disordered breathing.
Okay, so we're not just talking about feeling logy in the morning or dragging it out all day long. You're talking about so many related problems, including a potential for death.
Yes. Basically, you should be able to sleep 7 to 9 hours a night and make it through your day without feeling tired or feeling the need to drink caffeinated, sugared beverages. If you feel the need to take a nap or you have excessive daytime sleepiness, you could have a problem. So it's really important, too, that people make sleep a priority, because that's your brain. Your brain is your tool. That's what sleep restores your brain, and that's what restores your whole body.
Okay, but wait just a second. Excuse me.
Sure.
Don't consider this to be an argument with sleep specialists. But Usher, one of the most successful people in show business today, and I mean not a desk usher, but a singing and dancing and active and moving and working and traveling usher, the other day he said, if I get 3 hours of sleep, that's fine with me. I can operate all day long. Is anybody capable of doing that?
I would say that if you're operating all day long, you're definitely using caffeine or other methods to stay awake, because the brain and the body needs more than 3 hours of sleep. Yes, people do it, but you're hurting your body over time. You're causing detriment to your health.
He stays up all night and gets things accomplished because people aren't bothering him. And of course, probably he has a cell phone right next to him at one time or another, just to make sure those all-night conferences can take place. How good an idea is that?
Well, not a good idea. Definitely should not have any type of, any noise. Even when we do a sleep study, we can actually see a patient can be sleeping, but if a door slams or the slightest little noise, we see the brain have what we call a K complex, which interrupts the brain. So you think you're asleep, but it'll kick you out of even like a REM stage of sleep where you're dreaming any type of noise. So we always recommend, dark, cool, quiet environments, no cell phones, no computers, things like that.
But of course, if they have AZTV on all night long, a lot of people I know use the television to put themselves to sleep. And I am told by specialists like my wife, that's stupid.
Yeah, well, having light enter the eye stimulates the brain.
Even with the eye closed?
Yeah, well, even with the eye closed, yes, because what it does is it makes your brain think that it's daylight. So our brains need dark to be able to sleep all night.
Okay, what about the kids? I continue to read these studies about kids as young as elementary school not getting enough sleep. And then it progresses even worse and more dangerously and more non-productively as you get into high school and then college. True?
True. Children need a structured environment. They need to go to bed at the same time. They need to wake up at the same time. As you get older, in the teenage years, your body wants to stay awake longer and sleep in later, which is a problem because high school starts early. So I really encourage parents to try to get their teens calm down earlier in the evening, get all their homework done, make sure all the cell phones, the computers, the iPads, all those things are turned off so that they can go to sleep and get up early so that they are, alert all day long and can learn. Younger kids, we're seeing now more and more of these children get diagnosed with ADHD, and some of them even have sleep disorders. So it's very important if your child is having trouble paying attention in school that they be evaluated on how they're sleeping.
But Lisa's got triplets. What if one of them, yeah, immediately everybody responds to say, oh! What if one of the triplets has that regular pattern of sleep and goes to sleep at the same time and no problem, no discussion, no argument, and the other two don't have the same pattern?
Well, it becomes a discipline issue. You really need to train your children to go to bed.
But aren't there individual needs, though?
There are, but again, if parents at a young age will teach their children a cool, calming routine at bedtime, it will pay off through the rest of their life.
Just a second, I'm going to jot that down. Lisa with triplets, cool, calm night times, right? Okay, that's fine. Is everybody giggling about that?
I didn't have triplets, but I had 3 kids, so I definitely know.
Well, then you certainly understand. Okay, what about the appliances, particularly for those who suffer from sleep apnea, that terrible cessation of breathing, and then we see these apparatuses that people put on their faces?
That's called CPAP, which is continuous positive airway pressure.
Do you use those?
Yes, we do use those. We also use oral appliances. So there's lots of options now, and it's not this huge contraption anymore. We actually have little small cannulas that fit just across the nose. We have pink for ladies, and we also have dental appliances.
I'm glad you've made some progress, because you know what?
Yeah.
I have seen pictures of people sleeping. They look like Hannibal Lecter in bed.
Well, here's the thing. I saw a doctor one time, and he said, he had 2 patients, and they were really struggling with, just libido and all this stuff. And he sent a picture, and it was the husband and wife wearing their CPAP, spooning, and it said, "We might look like a couple of elephants, but man, we're screwing like rabbits." So the trick is you need to treat your sleep apnea because you're going to feel better. You're going to have more energy.
You just gave us another incentive.
Yeah, exactly.
Okay, tonight, one quick tip tonight for people to get a better night's sleep than they have. They should start by doing what?
Turn down your air conditioning. We live in the desert. Turn your air down 10 degrees when you go to sleep. Take a warm shower, a warm bath, and then get into bed. You'll go right to sleep.
Wow.
Yep.
That's nice and inexpensive.
Yes.
And particularly if you turn the air conditioning down.
Yeah.
Okay, you know how the Sleep Center works, and you know that our guest knows what she's talking about. Lori has been with us to let you know that, yes, you can get a good night's sleep, better than perhaps you ever have before. This is Pat McMahon.